A lot of kids seem to have allergies to peanuts and some other kind of foods, and they carry around this thing called an Epipen. Can you say something about this and why some kids will carry it?
Over the years, we've seen that there are some patients, when they're exposed to certain foods, peanuts being one of the most notorious, can have very severe allergic reactions known as anaphylaxis. If you are allergic to a food like peanuts and anaphylaxis occurs, it can be a life-threatening condition. The symptoms of anaphylaxis would include hives, breathing difficulty, swelling of the throat, and perhaps feeling faint and having an abnormal heart rhythm or blood pressure. These types of symptoms are truly emergencies and need immediate medical attention. An Epipen is a device which carries adrenaline. It's a device that looks like a pen and will automatically inject the adrenaline into the skin once this pen-like device is placed against the skin with only a small amount of pressure. The advantage of adrenaline, given in this fashion, is that it allows the medication to enter into the body very rapidly, reversing these life-threatening symptoms I've just described. So, if anaphylaxis is a risk in you because of your severe allergy to these foods, then having an EpiPen on your person at all times will allow you to administer this emergency medication and prevent a life-threatening event from occurring. The thing to remember always is that the medicine that you're giving in the EpiPen is very short-lived. It lasts only about 20 minutes in your body. After that, it's gone. And so the medicine buys you time. Once you use an EpiPen, you need to seek immediate medical attention so that if, as the drug wears off, symptoms start to come back, you have a physician available who can continue the treatment in the proper fashion.
Sometimes it might be wise to even have two EpiPens, because if they don't get to you and the kid's symptoms are persisting, sometimes they even give a second dose now, I've heard.
Yeah. We generally have a patient have two EpiPens available. 20 minutes is not a very long time, and symptoms, as I said, can recur once the first adrenaline shot wears off. So having two EpiPens available is an excellent precaution so that if you are not yet in medical attention, you have a backup dose so that you can prevent that serious event from returning.
If the kid has some difficulty in swallowing and has this history, it behooves the parent not to be afraid to give it, and delay might be life-threatening?
Absolutely. One of the most common problems we have is that even when we have identified the child as being at risk, and even when we've prescribed the EpiPen to the parent, when the time comes, is too nervous or scared to actually give the medication. There is very little, if any, downside risk for giving a dose of adrenaline to your patient. The side effects, tremor, nauseousness, heart rate will go a little faster. Remember, I said it wears off within 20 minutes. So if you have a child that's having a severe allergic reaction and there's any question in your mind, it's always better to give the dose of medication, call your ambulance or go to medical attention immediately, and then follow through in that fashion.
The storage of this is important too. You don't keep it for years. Should you be careful how you store it too?
As with any medication, an EpiPen has an expiration date. Never hold an EpiPen beyond the expiration date. Always get a new one once the expiration date comes. There are also very clear-cut descriptions of the temperature range which to store the epinephrine. You need to avoid extremes of temperature by all means, and it is clearly written on the device. For example, you never want to let that EpiPen sit in your car on a hot summer day. The medication will no longer work once it's been sitting in that type of temperature for any length of time.
Thank you, Dr. Marcus.